welcome to our healthcare panel. Tonight, we have 4 panelists that I'd like to introduce to all of you. We have Angela Brown from Cassia. We have Rob Brock from Boston Scientific. We have Anila Idani from Habit Aware, and we've got Christy Moline from Bethel University. My name is Molly Wickham, and I'm going to be your moderator tonight. And we've got Judy Jones, who is here today as well, providing technical support.
Before I jump into that, I just want to thank each of you and Bethel and the rest of the panelists. And I was kind of, as I was thinking through my my comments tonight, I thought, you know, I don't want to come across like I'm like disparaging anybody else. I think we're all super passionate about where we're at and what we're doing. So I was going to encourage the participants and listeners to take it in that vein, and not that, you know, well, what we do is better than anybody else, but just that we're super passionate about what we do and why we do it. So one of the things that I think is super exciting is how God uses such different ways to get us where he wants us to be. You know, some people are on a really straight path. Sometimes it's a curvy path. Sometimes it's a seemingly random path. But, you know, that's what he uses to get us there. Mine was seemingly random, but in the end, not at all. So my bachelor's degree is in business administration and speech communication. Had no idea really what I wanted to do with that until I got pretty close to graduation. And then I started thinking maybe HR, but I actually started in higher ed as an academic advisor for undeclared majors before I went down that road. So similar to some of the people in the CAPS program, I actually went back to school to get a master's degree in HR to get into the field that I wanted to go. So that was kind of my springboard. But, you know, where I went from there was really just networking and connecting with people to end up at Cassia. So Cassia is an organization that is a faith-based nonprofit organization that provides healthcare and housing to seniors, older adults. And so at the time, I was not necessarily on that straight line path to older adult services, but I just wasn't finding anything else. And so I had a network connection through somebody at church, and they said, well, we know this great organization. We think you could be a fit. And so it was that reference that got me into the area that I did. Once I got there, you know, I really fell in love with it. I fell in love with, you know, what we do, the ability to provide services to older adults, the opportunity to use my specific professional skills in a way that made an impact on the lives of older adults, even though I wasn't, you know, a direct hands-on caregiver by nature. But a group of people who I feel have really contributed so much to society through their lives, and maybe are now in a spot where they just don't have that ability to do so in the same way. And sometimes in a situation where society can kind of disregard them or undervalue them. So for me, it was a neat way to be the hands and feet of Christ in just a different way. So even though it's not direct, it's that indirect way, and to know that, you know, we are making a difference. So in our field, there are a lot of nonprofit faith-based providers who, you know, do that care and do what we do from that foundation of serving and glorifying God, which I think is a neat opportunity. Not all professions or areas have that option. That's something that has been really fulfilling and encouraging for me. So I have stayed, I joked earlier that I have been at Cassia for 29 years, which means I started when I was 5. If you're doing the math, that's it. But the organization has grown and changed significantly. So we were about 750 employees in about 4 campuses when I started, and we have grown to the point where I now oversee all of HR, and we have about 5,500 employees in 5 different states. So I think one of the things that's exciting about older adult services, and particularly about Cassia, is just the ability to not only grow professionally, but to, you know, work into, as the industry that you're in grows and changes, the ability to learn and grow within that. So that's me.
Thank you. That's a great introduction. Rob?
Yeah, thank you for the opportunity to be able to share. And Angela, I appreciate what you said about, you know, different career paths, and sometimes they're unexpected and sometimes they're more direct. And I've had sort of a parallel career path in ministry, and then ultimately in for a long path in medical technology. I work at Boston Scientific. I'm a principal product manager there and do new product development for the company. But I started in my undergraduate degree in biochemistry and spent a bit of time doing molecular genetics research at the University of Minnesota, and enjoyed that, but felt a call into ministry. And so actually we left that, and my wife and I spent several years working with a church plant in full-time ministry, and then came back to the Twin Cities to be close to family. And I wanted to get into med tech, something to leverage my degree. And ended up working at Guidant Corporation, which was acquired in 2006 by Boston Scientific. But I started at Guidant in 2003, and just kind of wanted to get my foot in the door. Started working in their customer service, their patient support organization, and then realized this is a great company. I enjoy the work that we're doing there. It's really meaningful. I want to be able to work into product development, and so knew that early on. And so then I started doing part-time work on an MBA, and did an MBA part-time over several years, and then started working in our marketing group in 2007. And I've been there since then. I spent a short period of time doing what we call, in our group, we call downstream marketing or product marketing, which is basically taking our products and commercializing them to the markets. But most of my time has actually been spent in what we call our upstream marketing group or strategic marketing, and that's new product development. And that's where I've really just enjoyed my career there. And so I get to spend a lot of time with customers. Actually, pre-COVID, it's been sort of this COVID timeframe has been tough because I haven't been able to be with customers directly as much. But I would typically be out 2 or 3 times a month traveling in the US or Europe or around the world, being in hospitals, being in surgical suites, watching customers using our products, talking with physicians, with nurses, with all different folks in the care spectrum there about the products that we're using and the products that they need, going to conferences, and then coming back and working with our engineering teams to design products and then taking those prototypes back out to the field. And so it's been a great process and progress over time. One of the things that I think was most helpful for me, and I also am able to work with Dr. Wickham and teach some at Bethel here as well. I teach marketing and then business management. And I always encourage people, students, to take the Strengths Finder, because that's actually one of the reasons why I ended up in what is a role for me that I feel is like what I was made to do. Strengths Finder early on revealed to me some things that I hadn't really even realized about myself. And the more I internalized that and talked with folks, I thought, that sounds like a career in making stuff up, creating new things would be perfect. It sounds exciting. And so that's where I've ended up. And I've really enjoyed that. So I know that there are a lot of great resources at Bethel for that. And I just encourage you, if you haven't taken it, if you thought about it or you took it and you've never really spent much time with it, that has been really meaningful for me to really kind of chase down a path that plays to my strengths. And so that would be my encouragement for you as well, regardless of how circuitous your path is to get to that end point. I'd really encourage you in that.
I'm going off
Thanks.
script. I'm going to ask you, what's one of your top strengths?
Well, so I am strategic and futuristic are the top 2, so for new product planning, those work really well for me.
Thank you. That was a great introduction. Anila.
Hi, everyone. I'm also very grateful to be here today, and thank you for the opportunity to allow me to share my story about starting Habit Aware. I think that the theme that's emerging in hearing a little bit of Angela's story and Rob's story is kind of this idea that whether the path is direct or curvy, you always kind of wind up where you're supposed to be. And that's very true for me as well. I studied undergrad for accounting, and I did audit for a while, and then I went back to school to kind of shift gears from the analytical to the creative side, and went into advertising. And then things just kind of evolved organically to create Habit Aware, which is a mental health tech company based here in Minneapolis, where we make a smart bracelet that helps people overcome subconscious mental health conditions. So that's things like trichotillomania, which is compulsive hair pulling disorder, which is a condition that I grew up hiding out of shame and fear of judgment. And a few years ago, my husband caught me without eyebrows, And then we're sitting on the couch one day and he's noticing that I'm pulling and he gently grabbed my hand. And that was kind of the aha moment of, oh, if I just had something that notified me, I can make change. And so we quit our day jobs in advertising and him in corporate strategy to build the device, build the company with two friends, co-founders, and help thousands of people around the world. So definitely not where I thought I would ever be, but also exactly where I thought I would be, if that makes sense. Fulfilling my purpose.
That is really fascinating. Thank you for that great introduction.
That's okay.
Chrissy, tell us about yourself.
Of course, no problem. So I'll start like with the current, my current role, and then I'll work backwards to give you the full story of how this has transpired. But for the last 4.5 years, I've been leading the Center for Healthcare Excellence at Bethel, and we work intentionally to attract students broadly to careers in healthcare. And so that looks like doing things like we're doing tonight, where people can actually hear others' career journeys, because that's a valuable part of the story and how students can begin to see themselves in some of those roles. And so I've been doing that for the last 4.5 years. Recently, I've added oversight of the career development and calling area. And then relevant to what I will share with you as my past experience is I've been leading all of our COVID operations at Bethel since late June of last year. So navigating the complexity of not being able to control 18 to 20-year-olds through a global pandemic. So that's the interesting part. Is now I will jump back to what I plan to do and how my career journey has transpired. But my undergraduate degree is in community health with a biology minor, and I also have my MBA. My dream job was to be an environmental sanitarian. And if you don't know what that is, I don't blame you. It's a restaurant inspector. That was all I had in my mind of something I wanted to do. And I never actually ended up doing that job. And that's the interesting part about, as we talk about this, career progression. I never did the job that I really felt like I wanted to do in my, 20-year-old mind. But through a series of experiences, landed exactly where I was supposed to land along the way, and feel like that's the part that I want to encourage all students who are wondering what they are to do next. Just take it in stride and learn what you can at every step. But so not getting a job as an environmental sanitarian, I did take the first public health role, which I was hired for, and that happens to be at a local public health agency planning for the, unthinkable, a global pandemic. So I spent my early career planning for this very time that we find ourselves in now. I planned for 2 scenarios. I planned for a global pandemic. We planned for flu, not COVID. And I also planned for a terrorist attack using anthrax across an entire metro area. So as a result of that, I did sprinkle in a couple of other things, but also did start a company called Emergency Preparedness Resource Group, where I consulted for 6 years with local public health and other first responders on how to respond to public health emergencies, including global pandemics. And then I put that in the closet and moved on. And I went then to children's hospitals and clinics, where I spent 9 years of my career building programs. I built the injury prevention program at Children's. I built their telemedicine program to provide virtual care for children anywhere. That was our goal, was to not limit access to pediatric expertise because of geography, and took that out of the equation with technology. And believe it or not, it was a hard sell back then, and now, what didn't you know? I bet everyone has had a virtual visit by now, and they can't believe they ever did doctoring any other way. But so I share all of that to say, now look what's coming full circle. I literally never thought I would leverage any of my public health emergency work again. And that is why I ended up leading the COVID response at Bethel. I was a bit of a unicorn in that I probably was the only person who had ever planned for a global pandemic in their entire career. So I got that by nature. Anyway, that's my career journey, and I'm looking forward to answering some of the other questions in that context.